Let me tell you more, as I'm the only one with a larynx that works today, about the aims of HIC-SUM-U, as we like to pronounce it. Although it took us, I'll be honest, the best part of the first 6 months of our existence to stop saying HCSME. At that stage, most people lapse into a coma. You know, you don't care what it's called by the time you get to the E. So, Healthcare Social Media Europe. We had, when Silja and I came together in August of last year, as she suggested on the slide, over Twitter and subsequently by Skype, some rather lofty ideals, but you know, this isn't our community. We just had the idea of creating it. The folks that you've seen in this room, the folks who contribute every Friday, it's their community, not ours. Our aims really, we felt, were to attempt to revolutionise healthcare through patient focus. The rest of this really is what we would quite like if happened. Will it happen? Who knows? It's not down to us, it's down to the folks who participate. But ultimately, I think we would all agree that our aim is on the patient. It's on patient outcomes. It's upon democratising the health conversation. It's about facilitating access to reliable, relevant information on the patient's behalf, putting the patient, as our friend from Patients Like Me said earlier, front and centre. Everything we do is for the patient. Everything else is secondary. So in so doing, to drive adoption of social media, we hoped in healthcare across Europe in order, and again, I agree, lofty aims, but why not, to improve the quality, access, value, and effectiveness of healthcare delivery to patients. So we were hoping this could be accomplished by means of gathering together and facilitating the interaction of a community of like-minded individuals who shared those aims and goals. We didn't know if they existed, in all honesty, when we had our first tweet up in August 2009. We didn't really promote it that much even, but I guess what we demonstrated to ourselves, and the community has continued to demonstrate to itself, is that people are listening, people are monitoring, people do care, and people want to talk about these subjects. So we hope ultimately to contribute in a modest way to the decision-making of governmental bodies, administrative bodies, in order to provide, we hope, or at least assist in, clarifying and adding transparency at a regulatory level. So we would also like to go on to create a space within which knowledge can be shared for patients and open access resources listed, collated, and brought together. We're aiming to chronicle, but also hopefully to influence the evolution of the health conversation on the social web in Europe, and through our connections with HIC-SUM in the States, the US. We're hoping that we can, as I said, in part move towards a place where we feel the health conversation is more democratic, that each of the key constituencies, healthcare professionals, the industry, most importantly patients, but also the underserved communities like carers, who I'm pleased to hear we have heard mention of today, feel that they have a voice. And in part, all of those communities are represented in HIC-SUM-U at the moment. We wish to ensure impartiality. We don't belong to any constituency. I think in the first instance there was the misapprehension that we were somehow a test bed for Pharma's social media policy. We're not. We're not interested in one particular constituency. We're interested in how all constituencies interact. And we're independent. No one's got paid for this. There are no dark forces behind the veil who are forking over wedges of cash to Silja and myself. She hasn't got like gold bath taps back there in Switzerland. I don't think she has anyway. Gold shower maybe, I don't know. But I shouldn't have said that, should I? Can we edit that one out? This isn't on Ustream or anything. Okay, ground, swallow me up. So no one pays anything to participate. I'm still reeling from that. I should be a pro, shouldn't I? And just brush that one off. But. So what will we go on to do? Well, we held our first in real life meeting in Berlin in March of this year. It was a fantastic meeting. Hands up in the room if you were at that meeting. Well, that's terrific, yeah. There were 50 or so souls who took a day out of their working life to find their way to Berlin and participate in what was a fantastic day. You can see on the HicsMU camp site, which is hicsmu.wordpress.com, how we ran the day, what an unconference looked like for us. But these were the outcomes that we ended up writing on a pad on the wall. We wanted to build a knowledge hub, and we're getting towards that. We've created a wiki, which is hicsmu.wikispaces.com, where we're finding, adding, updating data. We wanted to establish national chapters. We're all about outreach, and again, I'm delighted to say there are people in this room who've been making that happen. We have active chapters in Spain under the hashtag HicsMUES, France with FR on the end, the UK chapter is consolidating itself, and so on. Switzerland, Greece and Austria are also in the works. And data collection, analysis, redistribution with the aim of advancing our objectives. In all honesty, we're not sure what that looks like at the moment. This is still something that has a question mark over it, but we've had strong offers of help and support, and it's something that we're going to move towards. What will we go on to do? Well, one of the things that we did at the event in Berlin was output one of the sessions into a Wordle, just to see the kind of language that we used in the session that was entitled, What Will SMU Go On To Do? And it appears that we consider, hopefully not overly hubristically, that we have a capacity to help on the basis of the diverse and broad skill sets that the members of the community have, to act as advisors in some capacity, to act as a resource, to serve the patient, and advance the shared healthcare initiatives that we all believe in and want to be a part of. So that, in essence, is what we hope we're going to go on to do, and it's an overview of what we've done thus far. But I suppose the most important question that I have today, other than can I just erase the last 30 minutes of your life so you forget that 15 seconds of embarrassment on my part, is what will you go on to do? If any of what we've talked about today and any of the aspirations that we've shared with you appeal to you, then please join us. I mean, we all know the metric that we're 1% creators, 9% commentators, 90% observers. It was really great to see that there are a number of you in the room who have used the hashtag, have followed us, or at least aware of us. But more than that, we would appreciate your contribution and your participation. There's nothing in it for you other than hopefully the pleasure of participating, and probably the most important gift that the community brings, which is connection. I think everybody who's participated in it in HicsMU will feel that they have taken as much from the community in terms of the connections and friendships and relationships they made as they have given back. So we convene every Friday under the HicsMU hashtag at 1 o'clock European time, noon UK time. That's us.
Thank you, Andrew. I think what's interesting is going to be the increase in volume of tweets following your presentation, Andrew. I think it's just gone viral, I think, that particular comment. Right, moving swiftly on, I think we better do.
That's a once in a lifetime.
Are there any questions for Andrew to answer verbally, or for Silja to answer via tweet? Okay, fine. Andrew, I was going to ask you, sorry, there's a question? Sorry, I didn't see. Is that Neil? Yeah.
Hi there, I'm Neil from Aurora. I just want to say, to Sylvia's point about taking part, I started taking part about a year ago in HicsMU, and initially it was really scary to do a tweet up. It really is confusing. It's like being in a noisy party with everyone talking simultaneously. But just be brave, and Andrew said you don't get much out of HixMU, but you do learn, the connections are great, but you also learn a huge amount. So if you're kind of putting your toe in the water when it comes to social media, actually taking part in the tweet up is a really good way of you actually seeing what engaging in a community is all about, and then you could apply that to your sort of broader working life. But just go for it and jump in, because it is really fun.
Excuse me,
Yeah.
I'm going to tweet my answers.
Okay.
You see them there.
Okay.
I can't see it.
Up on the Twitter.
Whilst you're tweeting, Silja, can I just a quick question? Just curious to know this. Does anybody who work in Pharma here and using in their work environment on their work PC have access to Twitter blocked? 1, 2, 3, okay, 4, okay, interesting, okay. So the vast majority of you don't, but there still are pockets of companies who block access to Twitter in the workplace. Interesting, okay. I think we may want to take that conversation down a bit.
No, we're all about transparency, unfortunately.
Okay. Any other? Silja, you finish your question? Oh no, backspacing, going forward, back, no, nope.
Celia's saying, for those of you who don't have access to Twitter or are sitting any further back than me, because I can barely read it, is that she thinks participation is tough in HixMU in the beginning, but it gets better. Although there's a dip about a year and a couple of days after you form the community, as I've just demonstrated. But